and welcome to this special show. Now, diabetes in India is a growing health problem with more than half the population at risk of developing the condition at any time in their lives. Diabetes mellitus is a widely diffused chronic condition that impacts several aspects of patients' lives. If this is not managed, then severe complications could in fact develop. Now, several religions around the world practice fasting for spiritual reasons, but fasting can actually cause serious health problems for those with diabetes. Changes that occur in the body during fasting depend on the length of the fast. They can affect the body if proper care is not taken while undertaking these fasts. Also, people are choosing various types of diets to lose weight quickly, and these can also affect your metabolism quite badly. Well, we're going to discuss these and wide-ranging issues regarding diabetes, and as always we have a distinguished panel of medical guests with us. Dr. Professor Subhash Wangnoo, Head Obesity, Diabetes and Endocrinology at the Apollo Hospital in New Delhi, is with us. Dr. Archana Sarda, Member Type 1 Diabetes Task Force, RSSDI, Consultant Diabetologist with the Sarda Center for Diabetes and Self-Care in Aurangabad, joins us, as does Dr. Azaz Khan, a diabetologist and family physician at the AK Wellness Clinic in Mumbai. Dr. Wangnoo, let me begin with you. Now, obesity is also a condition that it seems can cause diabetes to worsen further. Is it true that losing weight could actually put diabetes into remission, and how much weight loss is recommended per month for those who have an existing diabetic condition? Dr. Subhash Wangnoo?
I'll give the answer one by one.
Okay.
Obesity and diabetes, they run parallel to each other. As the obesity incidence is rising throughout the globe, similarly the diabetes incidence is also rising throughout the globe. And number two, what we call the twin epidemic, diabetes and obesity, we call it diabesity. A twin epidemic of both diabetes and obesity, one lead to each other. And obesity is an important cause for the development of type 2 diabetes. That is number one. Now, number two, the people take a lot of fasting to lose their weight, to cut down the weight, and there are a lot of fat diets which are doing rounds along the whole the country. But frankly, telling as an endocrinologist, we always tell that dietary restriction should be under a medical supervision, under the supervision of a trained dietitian, because everybody needs different kind of a dietary schedule and the physical activity to lose weight. There are a lot of what I call the important dietary restriction like intermittent fasting, which may be good for someone, which may not be good for others, depending on what kind of a diabetes they are having. And if you think slow and steady weight loss, even over a period of 1 year, even if you lose 10 to 15% of the body weight, it gives you tremendous metabolic benefits in terms of weight loss, in terms of the diabetes control, in terms of the blood pressure control, in terms of the better cholesterol parameters. Now, the last question regarding the remission of diabetes. Again, this is a myth. There are a lot of news circulating, not in the YouTube, even in the Twitter, everything, Facebook, that diabetes can be reversed with the diet alone. See, I will tell you, first of all, you must know the definition of remission or the reversal. If a patient is a diabetic and if his HbA1c remains less than 6.5 for more than a year or two, we tell the patient is into remission. A very important trial which has been done in the UK, where they have given very low caloric diet up to the tune of 865 kilocalories per day. It is called the direct trial, where they have shown giving this diet by the GP under the medical supervision, if the patient lose weight more than 15 to 20% over a period of 1 year, there was resolution or the remission of diabetes lasting for 1 year to 2 years in patients who are on a constant, very low caloric diet under the medical supervision. So what I tell the intermittent fasting, any kind of a diet, whatever a doctor or the dietitian suggests, should be done under the medical supervision, and slow and steady weight loss is more important rather than having a rapid weight loss. Because some of the diet they cause rapid weight loss, which is not good because you get a rebound weight gain after some time when you start resuming the diet intake. So this is
Right.
the basic message what I want to give it to you.
All right. Dr. Sarda, what about intermittent fasting? Now, this is something that we're hearing of more and more. There are celebrities who do intermittent fasting. There are many websites that have spawned which talk about the wonders of intermittent fasting and how it helps you lose weight very rapidly. Now, this helps you eat fewer calories and it can boost your metabolism at the same time. But can it be useful for people who are also diabetic? And is it a safe diet to follow if you have diabetes?
Okay, so intermittent fasting or a different kind of time restricted eating or even different kind of diets that are available today. This is just one, but there are so many others. We have the keto diet, we have the paleo diet, we have the Mediterranean diet. So all these diets have a certain standing when it comes to their use scientifically. Now, using them in a person with diabetes, there are lots of factors. If a person is obese and pre-diabetic without any medications, the doctor can take a call that this is a person who can benefit with time restricted eating or intermittent fasting. But imagine a person who is on medications which is working 24/7 and person stops eating for say 16 hours in a day, and there would be hypoglycemia. So it comes with its risks. That is one, the major risk being of hypoglycemia with the medicine. So anyone with diabetes who wants to undergo a special diet should be under a doctor's supervision. No two people are alike. If I benefited, it does not mean that my friend will benefit. It needs a very good trained dietitian and a doctor to supervise this diet. Secondly, there's micro and macronutrition. There may be comorbid conditions. The person with diabetes may also be anemic, may be having a kidney problem, may be having hypothyroid. So the entire diet has to be very specific, medically correct. So intermittent fasting has a space, a very scientific space, but it's not for all. It's not a permanent solution and should be under medical supervision from an expert.
Right. Dr. Khan, on a related matter, there are those who might want to sort of shed the extra weight around their waist because this can actually mean, fat can build up inside the organs or around organs like the liver and the pancreas. Visceral fat can be a major risk factor for diabetes, can it not? And in such a situation, do these various diets or for that matter fasting help to lose that kind of visceral fat?
Yes, ma'am. Actually, this visceral fat around the belly fat, or you can say around the waist, the fat which causes many problems before. Overall obesity is a itself problem, but the visceral fat we just measure temporarily. According to outside, we can just imagine how much inside there will be around the organ. So visceral fat will be very dangerous for the diabetic patient, or in general this is for the many causes. Many diseases causes including diabetic is the patient. The best way try to reduce the visceral fat is trying to lose weight. Losing weight can be by many functions, like my another colleague says. It can be by intermittent dieting, keto dieting. The best is according to individually. We have to see individual people can do different things. But you have to reduce the weight by best is proper planning of diet and proper doing exercise. And exercise should be also by supervised, not like ordinary, but minimum you can do exercise, walking, and some cardio, then start go up like this. Regular exercise can stop visceral fat from coming back. If you continue manage your regular exercise and little bit diet, it can be very good for the diabetic patient.
All right. So you're recommending a combination then of diet and exercise. But Dr. Wangnoo, what happens to our body actually when we fast? And is this different for those who have diabetes? Can they face other challenges when they're fasting?
Absolutely. Before I answer a question, let me first tell there are now certain newer medications which are available now for diabetes, which are particularly important for reducing the fat around the belly, around the pancreas, around the liver, and around the heart. These are newer drugs called GLP-1 receptor agonists and the SGLT2 inhibitor. Now coming to the what happens during the fast, in the body is a unique organ. When you fast, for example, you're fasting during Ramadan or you're fasting during Navratra, initially when you're fasting, the brain requires glucose for its energy. And this energy comes from the breakdown of the glycogen from the liver, a process called glycogenolysis. And this breakdown of glycogen, the glucose, provides energy throughout the time when the patient is fasting up to a particular period of time. After 24 to 48 hours, when the glycogen stores are lost, the patient starts burning his fat to produce ketone bodies, which the brain acts as an alternative fuel for the brain energy. So you have to fast depending up to what level your liver can compensate your fasting by producing extra glucose through the breakdown of the glycogen. So prolonged fasting is associated with the formation of ketone bodies in the body, in the blood, and if the patient is a diabetic, it may lead to the ketoacidosis or diabetic ketoacidosis. That is important. That is why the patient during Ramadan, when they fast, is equivalent to just like intermittent fasting, fasting from dusk to dawn and just eating during the night. And the recent meta-analysis have shown that fasting during Ramadan will be able to reduce at least 1.5 kg over a period of 1 month. But it is only for those patients who don't indulge in eating lot of caloric dense foods during the night time when they are eating. And that is important, that we have to advise the patients who are fasting during Ramadan, particularly those who are diabetics, don't indulge in eating very high caloric stuffs. Just indulge in normal diabetic food diet so that you don't gain much weight. Otherwise, instead of losing weight, you start gaining weight. And the moment the Ramadan fasting is over, there is rebound weight gain. So this is important, that body changes, makes its changes, burning of the glucose from the liver, the production of glucose, then burning of the fat, burning of the muscle protein. But ultimately, patient should not fast beyond certain period of time.
Right.
And that is why when the patient is on prolonged fasting, we have to do urinary ketones, that it is not causing collection of ketone bodies in the blood.
Right. So Dr. Sarda, then, obviously there are sometimes societal or religious pressures on people who perhaps shouldn't be dieting for such long hours to do so during Ramadan, during Shivratri. So in that event, what would you recommend that diabetics do? If they have to follow such a rigorous and long fast, is it important to continue to consult with a doctor at all times? What are the sort of symptoms they ought to be watching out for? What sort of advice should they seek?
Absolutely. If anyone wants to fast and they have diabetes, whether it is, for example, a Navratri kind of fast where they will be eating something which is also usually quite calorie dense, it's not usually a fast in the sense of not eating, or Ramadan where they are not even having a drop of water, or only on fruits, only on juices, whatever is your type of fast. What is important is first you meet a doctor before keeping the fast, not after, when their problems have already occurred, which is what we see. Meet the doctor, tell them I want to keep this fast. What the doctor can do for you today is, first of all, is it safe? For example, if I have a patient who has CKD, which is chronic kidney disease, and wants to fast in the Ramadan, I will ultimately explain to the patient that you cannot do so. But if the patient is fine and I can allow the fasting, there are so many medications which can be adjusted as per the patient's routine. Today we have medications which will not cause hypoglycemia, which are slow acting, which act only on a meal, which act only for 12 hours. So depending on the kind of fast and kind of feast and the kind of meal pattern, we can advise how to eat properly during the fast, how to manage, how not to get dehydrated, how to compensate. And also the pre-screening before the fast is very important. And a lot of warning symptoms are there. For example, hypoglycemia. People, when they're fasting, we tell them that these are the signs and symptoms. If you're dizzy, if you're tremulous, if you're sweating, can be life-threatening. So do not ignore it. In spite of religious requirements, you must break the fast. So knowing all this, education, pre-screening, knowing the change of medications and dose moderation, all these things help people to keep the fast very safely.
Right. All of this is very useful indeed. Now, Dr. Khan, what about pregnant women? Should they be fasting during long periods of time, for instance, Ramadan, or even if it's for one night Shivratri? What should pregnant women with diabetes do in such situations?
Yes, ma'am. This diabetes normally in any pregnant woman should not do fast, because she not only depends on herself as a nutrition for food, but for her child also in his womb. So for diabetic to do, in case of diabetic, when she is type 2 or type 1 also, or gestational diabetes, if she do this type of things in Ramadan, for example, it's a long period, same thing Navratri. So they should, first of all, they should, from our doctor side, they should not fast. And there is exemption in religion also. They can postpone their fasting in next month when the baby is born and they are good. So better to not to fast. But still, when they are fasting, we have provided, like Madam said before, we should do pre-counseling for them before Ramadan, how to manage their diet, how to get healthy diet, and lot of drinking, small foods, and take minimum rest, what do you call, minimum exertion in the afternoon, and she can do a little bit exercises in the evening time.
Okay.
The food which she is eating, it should be very good, very high nutrition one, not like some pakode and some like this high calorie. She should be managed, and she should try to manage herself glucose according to her glucose meter. By glucometer, she should maintain her sugar. Anytime she feel that her sugar is going down or some different, she should break the fast as soon as possible, because it's a very long 30 days.
All right. All right. Thanks very much for that, Dr. Khan. We will take a very quick break at this point. But of course, our focus on diabetes and fasting, whether it's a diet, whether it's sort of societal or religious reasons for fasting, continues right after this quick break. We'll talk about complications. We'll talk about the management, in particular, of type 1 and type 2 diabetes. All of that in just a moment. You're with Beat Diabetes, Myths and Facts. We've been talking about fasting and its effects on diabetic patients. Dr. Wangnoo is still with us. Dr. Wangnoo, type 1 and type 2 diabetes management can be quite different. Is fasting then safe for all types of diabetic patients?
Absolutely true. For type 1 diabetics, it is a big no for the fasting, because they depend on the insulin for their survival. So the question does not arise for the type 1 diabetes on multiple shots of the insulin that they can go for the fasting, because the insulin is the life-saving drug for them. They cannot miss insulin, number one, and they cannot miss their meals also. Now, coming to the majority of the common garden variety patients, what we see is the type 2 diabetic patients, where many of the patients may be either only on the oral anti-diabetic drug, some of them may be on the oral anti-diabetic plus insulin. So we have to categorize the patient. If the patient is on tablet plus insulin, even if the patient is taking either twice daily insulin or 4 shots of insulin, the fasting has to be advised accordingly. A patient who is a type 2 diabetic but is on multiple daily insulin injection because of the long-standing diabetes, because of associated comorbid conditions, they cannot be allowed to fast. Patients who are diabetic with a stable control with HbA1c around 7 or 7.5, and they are on oral anti-diabetic drug or even 2 shots of the insulin, then the pre-Ramadan counseling, that doctor will tell what drugs you have to reduce at the Sahri and the FTR, and how much insulin you have to reduce during Sahri and FTR, so that patient does not get low blood sugar during the fasting hours. So that is very important. How is the long duration of the diabetes, whether a patient is on twice daily insulin injection, once daily insulin injection, or the 4 shots of insulin, what kind of the oral drugs patient is taking. So doctor will advise depending upon what kind of a treatment, what kind of a comorbid conditions you are having, like the previous speaker told about the chronic kidney disease. We have to talk about other illnesses also. So the pre-Ramadan counseling is must for all the patients.
Right. Dr. Sarda, is hypoglycemia or low blood sugar in particular a complication that one can see during extended periods of fasting? And if that is encountered, what needs to be done?
Yes. Sorry. Yes, absolutely. Low blood sugar is one of the major complications of fasting. Although if you look at different types of fastings, as we were just talking about people with type 1 diabetes, sometimes even children want to fast who are taking insulin. For them, the major complication is landing into diabetes ketoacidosis. So if they are without insulin and without a meal, they land in diabetes ketoacidosis, and that can be life-threatening for them. For pregnant women, it is going to be harmful for them as well as their child, and hence it is not recommended. So these two categories are absolutely not recommended. But in adults with type 2 diabetes, if they want to fast and they are on medication especially, there is a danger of hypoglycemia, which means low blood sugar. As Dr. Subhash just mentioned, that the brain needs a certain glucose level, and when that level drops, a person will be dizzy, will be sweating, will be having tremors, can faint. It can even lead to a cardiac event. So in all these ways, hypoglycemia can be life-threatening. What we do tell the patients, tell them and train them with the symptoms. They should have a glucose pouch or a glucose tablet with them at all times. At the earliest of symptoms, they should be able to consume it and save their life, and later go on to meet a doctor. Dehydration is another aspect which can be an outcome of fasting. So all these things have to be taken care of.
All right. Very quick last question to Dr. Khan. Is hyperglycemia also a complication we could see? So high blood pressure could be a complication as well?
Yes, ma'am. This is hyperglycemia is the major cause. Is the major cause in diabetes because insulin type 1 insulin definitely it's a major cause.
Right.
For type 2 also, if patient is uncontrolled, he is not taking properly medication, he is unable to take in fast. Morning and evening he can take, for example, morning he taken, evening he taken. But what about in between? If you have any emotional stress, other problem and dehydration or many problems. So there is a problem hyperglycemia. And the more important is when the patient take in the breaking the fast, iftar, it is called iftar, they try to take first shot is sugary fruits, sugary juice, like ruafza or something like this, and high calorie fruit like pakoda, bhajia, kebab, like this, many things. So this is highly not recommended for diabetic patients.
Yes.
To control this, they advise to take simple water and one dates. One date, small date, you can take with lot of liquid. Simple plain water. This is sunnah. And then they can go for fruits, and then third, put whatever empty is, then go for this oily and sugary fruits.
All right.
So according to this, they can plan them.
That's very, very comprehensive sort of roundup of then what can be eaten and at what stage. Thank you all for joining us on this discussion. We've discussed in depth what should happen when diabetic patients are trying to fast. It's not a complete no-no, but there are lots of checks and balances that must always be in place. Thanks for watching Beat Diabetes.